Does your low back hurt?
Oh, mine does.
There's a good chance it does, as almost everybody experiences low back pain at some point in their life. Low back pain isn't just annoying, it's very expensive, as it is the leading cause of work disability in America, thus decreasing production from absenteeism and even exceeding heart disease in lost work time. Now the plot thickens. Did you know that being obese and sedentary are risk factors for chronic low back pain? Just another reason to, exercise and eat right.
Exercise and eat right.
Now, exercise has been shown by research to probably be the treatment of choice for people with chronic low back pain, although no specific protocol has been established. Passive approaches such as bed rest, ultrasound, and hot packs are not well supported beyond the initial days of low back pain onset. You saw this coming.
What?
Research supports exercise in people with chronic low back pain
Oh, here's the lecture. Here
to
we
decrease
go.
their pain, anxiety, depression, and drastically improve overall function. Of course, the exercise should be done with care and consistency rather than an aggressive, haphazard approach in order to increase the probability of success. One of the toughest things about dealing with chronic low back pain is the fact that we rarely know what is causing the pain. There are so many sensitive structures so close together that it's nearly impossible to know what exactly the pain generator is. Now here on Bones, you'll see in his lumbar spine, you have the vertebrae and then the disc between them. Notice that
Watch
the
it.
vertebrae are bigger down here than they are up here. That's because they have to support more weight. Now pain can come from the disc, which
watch
is
it.
here, and notice Bones actually has a herniated disc right here.
A little sensitive there.
It can also come from the nerve where it exits the vertebral column here. It can also come from the facet joint, which is here. See, this is where the motion actually happens. Complicating this issue further is that research shows that 80% of people with the herniated disc, in the lumbar spine that is, do not have symptoms at all. So this means that just because you have a herniated disc in the lumbar spine doesn't necessarily mean you're going to be in pain. Now today I'll be showing you all kinds of tips and tricks to protect your low back from injury during resistance training and general exercise. While doing the exercises, most people are surprised to learn how poor their body mechanics really are, constantly compensating for muscle weakness by arching their backs or changing their postures in some way during resistance training. As always, I recommend working closely with your doctor and physical therapist when starting out on your exercise program for chronic low back pain. Okay, enough talk. Let's move.